Good afternoon, everybody, and welcome. I'd like to begin this webinar by acknowledging the traditional owners of the many lands on which we meet today. I'm coming to you from Ngunnawal country, and I acknowledge and respect their continuing culture and connections to land, water, and community, and I pay my respects to elders past, present, and emerging. I also want to acknowledge any First Nations people we have with us today. Welcome to today's session on all things cost recovery and what we have termed getting ready for provider registration, applications, audits and fees explained. Thank you so much for joining us. My name's Liz and I'm the Aged Care Quality and Safety Commissioner. Joining me on today's panel, we'll hear from Chris Davis, the Assistant Commissioner and the Chief Financial Officer at the Commission, Sarah Kelly, Assistant Commissioner for Registry, and Janine Renner, Director of Audit. So to set the scene, the Commission's current cost recovery arrangements will cease on 31st October and be replaced by new cost recovery arrangements for the Commission's regulatory activities under the new Act commencing on 1st November. In today's session, we will cover an overview of the cost recovery framework, we will cover fee and waiver arrangements, we will step through a provider renewal and variation scenario, including audit, and show you where to find and how to securely upload forms to the Commission website. We'll also cover where to find our helpful tools and resources, and we'll allow some time for your questions at the end. Just some housekeeping. This session is being recorded, and a link to the recording will be sent to everyone who registered in the next day or two. As well as the pre-submitted questions we received, you can ask a question at any time during the session. There will be a Q&A at the end and we will get through as many of your questions as we can. In the resources tab, you can see on screen, you will find a number of resources that will be referred to throughout the session. We will also share these resources and the presentation slides when we send out the link to the recording. We also have a short survey for you to complete at the end of today's webinar to provide us with feedback on today's event. Just stay online and a survey will pop up on screen. It's only short and your feedback is important to us, both in determining future topics, but also to understand the value of the topics we'll be discussing today. So I'll just go through the cost recovery overview. So cost recovery is when government entities like the Commission charge individuals or organisations some or all of the costs of a specific government activity. That can include regulation or providing goods or services. The Australian Government Cost Recovery Policy and Charging Framework requires cost recovery where appropriate, meaning non-government recipients of regulatory services should contribute to costs. Where the same activities are being provided to both government and non-government recipients, fees should be set on the same basis for all recipients. Currently, the Commission charges fees to become an approved provider and to accredit and re-accredit residential aged care services. When the new Aged Care Act starts on 1st November 2025, the way we regulate will also change and all providers of aged care services will need to be registered by the Commission to deliver government-funded services. This means new charging arrangements will be introduced from 1st November and current charging arrangements will cease. Fees will be charged for applications to become a registered provider, applications to renew or vary a provider's registration, and any related audits for these applications. Only some variation applications will be charged a fee. The types of variations that will incur fees are variations of registration to register in the new registration category, variations to remove a provider registration category, and variations to approve a new residential care home and add it to the registration. How are the fees being determined? They've been calculated by working out the efficient cost of each activity. Efficient costs are the lowest amounts we can spend to provide the activity in a way that achieves our policy objectives and legal requirements under the new Act. Fees include direct costs like staff time for processing audits, decision-making, and indirect costs like corporate overheads, ICT systems, and capital costs. Staff costs are based on the amount of time it takes to process applications, conduct audits, and make regulatory decisions. Fees are subject to annual indexation but do not incur GST. There are also fee waivers available for providers that meet certain criteria. These waivers are designed to support small providers and those in rural and remote areas to enter and continue to operate in the aged care sector. Fee waivers will also support increasing First Nation providers' representation in the sector. The fees and the fee waiver eligibility criteria will be covered in greater detail in later slides. This is stage one of a two-stage approach to implementing charging arrangements under the new Act. Stage one will cover the initial operations from the start of the new Act, 1st November 2025, covering regulatory activities similar to those currently subject to fees. During stage one, we will be engaging closely to understand the impacts of the stage one fees and fee waivers on providers and to consider possible arrangements for stage two. We will also be investigating the impact of fees on sole trader market participation as well. Travel costs associated with on-site audits are a significant cost driver but are currently not included in the fees. Finally, we've developed a range of resources and online calculators to help you understand the fees that will apply from 1 November under the new Aged Care Act. You can find this information in the webinar's resources pack. Both government and non-government providers of aged care must now apply for registration in one or more of the 6 categories to deliver government-funded services. This means applicants will be charged application fees and the relevant audit fees if an audit is required. The Transition Care Program and the Multi-Purpose Service Program are excluded from these charging arrangements because they are defined in the new Act as specialist aged care programs co-funded by the Commonwealth and states and territories and delivered within a closed market. Charging for activities associated with these programs would represent an intra or intergovernment charge, and as such, these programs are exempt for charging in accordance with the government's cost recovery policy. This means that registration, renewal or audit cost fees associated specifically with the TCP and the MPSP will not attract any fees. This table outlines the fees and waivers that apply for applications to become a registered provider. Every application includes an entity level assessment, and then there are additional charges depending on which categories are applied for. The fees differ depending on which registration categories you're applying to register in, proportionate to the risk and complexity of the categories you're applying for. Categories 4 to 6 are higher risk and take greater time to assess, therefore incur a higher fee. There is also a fee for residential care home approvals. A registration audit is required for registration in categories 4, 5 and 6. You can also see the fee waiver criteria for registration applications. A full fee waiver is available if you intend to deliver 85% of your services in modified Monash areas 6 or 7 or are an Aboriginal community controlled organisation. We're now going to look at a scenario, but before I start, I'll just mention the modified Monash areas. You've seen this term, I'm sure, before, but just to recap, the term MMM, it is the modified Monash model defines whether a location is metropolitan, rural, remote, or very remote. It measures remoteness and population size on a scale of modified Monash categories 1 to 7. Modified Monash 1 is a major city and modified Monash 7 is very remote. So for this example scenario on the screen now, there is a new provider applying to register in categories 1 to 5 to deliver home support services, and they plan to provide about half their services in modified Monash areas 6 and 7. The fee waiver notes that applications need to deliver at least 85% of care and services to individuals accessing funded aged care services located in modified Monash area 6 and or 7. And as this provider is delivering less than the 85% threshold, they are not eligible for a waiver. So the total fees they will need to pay are $29,550. This amount covers the entity level assessment, the category reviews for 1 to 5, and this registration audit. Now I'll hand you to our Assistant Commissioner, Sarah Kelly, who will take you through the registration, renewal and variation scenarios. Over to you, Sarah.
Thanks, Liz, and good afternoon, everyone. My name's Sarah Kelly, and I'm the registrar here at the Commission. So now we're going to step through the registration renewal process and describe in a little more detail what you as a provider can expect. So here at point 1 on this little wee roadmap, we have providers needing to apply to the Commission to renew their registration to keep delivering aged care services. We start the registration renewal process before the provider's registration expires. The Commission will send an invitation renewal letter up to 18 months before the end of the registration period. And the timing of the invitation depends on the size of the provider and the registration categories they're delivering care and service within, as this will dictate whether they need to have an audit against the quality standards as well. At point 2, based on your current registration categories, will determine and tell you in the renewal invitation letter if you're eligible for a fee waiver. And then at point 3, in the next step, if you accept the invitation to renew and you offer care and services in registration categories 4, 5 and or 6, you'll also need a renewal audit. Now here you can see at point 4, if you do require a renewal audit, we'll send you an audit invoice at this stage of the process. Mock-up copies of what the audit and renewal invoice look like can be found in the resources folder to this webinar. You'll have 14 days to pay the invoice, but there are extension options available, and that applies every time that I make reference to that time period for paying an invoice. At point 5, which is the last step on the slide, the provider then submits the renewal application form and pays the invoice that is then issued to them. The same payment period of 14 days applies here. Where there's a gap between the invitation to renew and the timing for when the application form needs to be submitted, the Commission will send you a reminder. If a provider doesn't submit their renewal application, their registration will cease at the end date. However, there are ongoing conditions and obligations that will apply, for example, while the provider works towards ceasing delivering care and services to aged care consumers. Once an application is received, we'll work to assess and make our decision on the renewal application, with a focus on assessing a provider's suitability, their capacity, and their capability. As part of the assessment, we'll also consider the outcome of any audit and other information and intelligence we've gathered or received during the provider's registration period. So this would include routine reporting, notification, information from complaints, and the outcome of any risk-based monitoring or compliance actions. When we decide to renew registration, we set the registration categories that the provider is registered in and the new registration period. If we're thinking about not renewing a provider's registration, they'll be given the opportunity to understand our concerns and provide additional information. This table shows what providers will be charged when applying to renew their registration. The fees are structured similarly to the registration fees, where there is an entity level assessment and then additional charges depending on which categories are being renewed. There's also a fee for any new residential care homes that a provider is seeking to have approved. Fees vary depending on the registration categories being renewed, proportionate to the risk and complexity of each category, and align with the work involved in assessing a provider's ongoing suitability at the time of renewal. A waiver is available if a provider delivers all of their services in modified Monash model 5 to 7 areas, or if they fall within the smallest 10% of the sector. This table outlines the fees for renewal audits and shows the cost of the provider level evidence gathering and category-based audits. The fees vary depending on the type and complexity of the audit, with Category 6 residential care home audits tiered by size. Category 4 to 5 audit fees vary based on complexity, low, moderate and complex. Factors such as how many older people receive care under Categories 4 and 5, as well as service delivery across more than one state, contribute to the determination of complexity. Waivers are the same as for renewal applications, except for Category 6 audits. For Category 6 audits, there is a grandfathering arrangement, and the criteria we used previously for reaccreditation audits applies. This means that if a service received a fee waiver for its last reaccreditation site audit, it will receive the same waiver, full or 50%, for the Category 6 renewal audit for the same residential care home. The waiver criteria will also extend to residential care homes that have not previously had a reaccreditation audit, using occupied bed days as a substitute for number of places. We now have a scenario to demonstrate how renewal fees and waivers apply these concepts in practice. In this case, there is a provider already registered in categories 1 to 5. They provide care and services to 112 people across modified Monash model areas 1 to 3. Their category 4 and 5 services are delivered to 72 older people in a single state. This means the total fees they will need to pay are $34,125. This covers the entity level assessment, the renew of category specific requirements for categories 1 to 5, and a renewal audit, with the provider level evidence gathering and the moderate complexity audit for categories 4 and 5. Because they don't deliver 100% of their care and services in modified Monash model areas 5 to 7, and they are not in the smallest 10% of the sector, they'll not be eligible for a waiver. I'm now going to pass over to Janine to talk all things audit.
Thanks, Sarah, and hi, everyone. My name's Janine Renner, and I'm one of the 4 directors of audit at the Commission. So for today, I'll be talking about renewal audits as it covers the end-to-end audit process. So there's also registration and variation audits, which include components of what I'll be showing you today. So this slide shows that there are 3 distinct stages to the audit program for providers. So stage 1 is audit initiation. Stage 2 is audit delivery, which includes a provider level and care delivery component. And stage 3, which is audit reporting. So the purpose of stage 1, audit initiation, is for the Commission to start engaging with the provider about the audit program and support them to prepare for the audit. So we do this through engagement, information sharing, and requests for evidence. So we will send out an audit initiation email to a provider and request that they complete our audit evidence collection tool. You can view a draft of this tool on the Commission's website, and copies are located in the resource folder for this webinar, and it will give you an idea of what will be required for you in the audit initiation stage. We'll have a meeting with a provider to talk about the audit program and what it looks like, and we'll also scheduling meetings with the provider. The purpose of stage 2, audit delivery, is to collect and assess evidence in relation to how the provider conforms with the quality standards. So this is broken into 2 sections, one which is focused on the provider and the other which looks at care delivery. So the purpose of the provider audit is to collect and assess evidence of the provider's governance arrangements, systems, and processes. So we will review the completed audit evidence collection tool and other Commission intelligence. We will also develop an audit plan, and we will undertake meetings with the governing body and senior management. The purpose of the care delivery audit or audits are to test whether the provider's governance arrangements, systems, and processes have been embedded and consistently applied in the delivery of aged care services. So we do this through the collection of evidence in relation to the care experience and outcomes of older people. So as part of this stage, we will request that you complete a care delivery evidence collection tool, and we'll use this to develop an audit plan to determine a sample of older people. And a copy of this tool is also located in the resource folder as part of this webinar. We will hold a care delivery location opening meeting, which is to include management of the sites we'll be targeting. And if we have an on-site audit, we will hold an on-site entry meeting. We will conduct interviews, observations, and file reviews, and we'll also have a closing meeting to provide details of what we found and the preliminary conformance rating. So the purpose of stage 3, audit reporting, is to communicate audit outcomes to providers. So we initially do this through a preliminary assessment report, which providers have 14 days to respond to, and this response will be taken into account before determining a final conformance rating against the quality standards. So final conformance ratings will be shown in the final assessment report, and providers will receive 1 report for each category 6 service and 1 that encompasses all sampled category 4-5 services. Providers will also receive a final audit report at the end of the audit program, which provides details of what we found at the provider and care delivery levels. So this will include sampled category 4-5 services and Category 6 residential care homes. It is important to highlight here that audit reports are one aspect to inform a provider registration decision. Our provider audit guides were released in August. They provide lots of detail about everything I've just gone through in relation to the audit process and more, and they can also be found as part of the resources included with this webinar. So in certain circumstances, the Commission may assess that an audit is not required, and this may occur when a health services standards assessment was conducted in the 3 years before making an application, and the Commission considers that a further audit under the quality standards is not necessary. So the health services standards assessment must have assessed the provider's ability to comply with the relevant accreditation requirements for both the National Safety and Quality Health Service standards and the Integrated Health and Aged Care Services module. So if the application relates to Category 6, the Health Services Standards Assessment must have covered and found compliant all government-funded residential care homes in which the provider delivers or proposes to deliver. If the application relates to Categories 4 or 5, the Health Services Standards Assessment must have covered and found compliant those services relevant to their registration category. In such cases where no audit is conducted, no charge is applied. So I will now hand back to Sarah Kelly to take us through the variation to registration scenario.
Lovely, thanks Janine. So we're now going to step through that provider variation scenario. So again, we have the same wee roadmap here, and at point 1, you can see that the first process step in the bottom left-hand corner, highlighted in blue, is that providers can make a request to vary, suspend or revoke their registration via the form that will be on the Commission's website. Provider-initiated variations follow similar processes to registration and renewal, with assessments and audits as required. Providers might ask to register in a new registration category, remove a registration category, add or remove an approved residential care home from its registration, vary or revoke a condition of registration added by the Commission, or suspend or revoke its registration. If a provider applies to be registered in a new registration category, the Commission does not need to reassess the provider against the general registration requirements. This is because the provider met these general requirements at the time of registration or renewal of registration, and it's implied through the deeming process. However, the provider will need to demonstrate that they meet the registration category specific requirements of the new category that they're applying for. If they are applying for registration in categories 4, 5 and or 6, they must also undergo an audit against the aged care quality standards. At point 2, we have the provider completing the form in full, and this will be uploaded through the Commission's website. A frequent example would be a provider applying to have an approved residential care home added to their registration, and this ordinarily occurs when that home is being transferred to them, such as being sold from another provider. At point 3, once the application is received, we'll send the provider an invoice. In the case of a variation to add categories 4, 5 and or 6, you'll also need a variation of registration audit and will receive an audit invoice. You pay the invoices within 14 days, and again, examples are included in the resources folder for this webinar. Point 4 covers us undertaking the appropriate assessment of the application. We may request further information or documents to make a decision about a change in registration. And before some changes can be made to their registration, such as removing a registration category, the provider must have appropriate arrangements to ensure continuity of care for older people receiving services. The decision generally needs to be made within 90 days, although this might vary if we need to seek additional information or undertake an audit. For simpler applications, it may well be considerably less. We will provide procedural fairness to a provider if we're considering not varying their registration in line with their application. And if we refuse to vary, suspend or revoke a registration, this is a reviewable decision and a provider can apply for it to be reconsidered. At point 4, we're reinforcing that where a provider is seeking a variation to add registration categories 4, 5 and or 6, there'll need to also be an audit undertaken. Here is a table showing the fees and waivers that apply for variation applications and associated audits. These apply when a provider seeks to change their registration to add or remove categories, or have a new residential care home approved. A separate charge also applies if a variation audit is required, such as when adding higher risk categories. The fees for variation vary based on the complexity of the variation. Scenarios where a provider chooses to remove a category with individuals accessing care will incur a greater cost than removing a category with 0 individuals accessing care. Removing a category does incur a fee, as the Commission will need to assess and ensure sufficient measures are in place to ensure continuity of care for any people currently receiving services under the categories that the provider is seeking to have removed. The key point is that variations are treated as significant regulatory activities, and fees reflect both the type of change and the need for additional assurance through any audit. You can also see the fee waiver criteria for variation applications, which are the same as for registration. This scenario now looks at what happens when a provider expands their registration through a variation application. Here, the provider is already registered in categories 1 to 5 and is now seeking to add category 6. As part of this, they also have a new residential care home to be approved in a triple M2 area. Because they don't meet the triple M location threshold in the fee waiver criteria, and they're not an Aboriginal community controlled organisation, they're not eligible for a full waiver. Altogether, the charges for this application come to $27,400. This total reflects the fee to add category 6, the approval of the new residential care home, and the variation audit that's required when adding higher risk categories. Now, it's important to quickly distinguish between a variation to registration and a change in circumstances. Variations to registration cover changes to your registration category, such as adding or removing categories, and these attract fees. A change in circumstance refers to operational or organisational changes, including changes to responsible persons, provider suitability, changes in service types being delivered, changes to associated providers, or when there are financial or prudential changes. And these changes do not attract fees. So now we'll step through where you'll find and download the forms for completion, and then come back to the Commission website to securely upload them for submission. As you can see on the screen, providers will be able to find the relevant forms on the Commission's website. There's the Commission's website front page, then the Providers section, and then Start an Application. From here, the website page will guide providers to find and download as PDFs the relevant forms based on a series of questions. Providers can select multiple options from this list. Providers can then fill out the downloaded forms at their own time using the guidance materials available. The forms have been designed to have the guidance materials open as you complete them to ensure you can provide complete and accurate information. It will also assist you to understand why we ask certain questions, as well as what we're expecting to see entered in the forms. Once you've completed the forms, you're ready to submit them and any required supporting documents. You will do this by returning to the website and finding the Submit a Completed Form tile, which will take you to the uploader. You'll receive an email with a unique link and security code to upload your forms. Check your email inbox, select the link from your inbox. The link will take you to this site where you can upload all of your completed forms and supporting documents. From there, click the link from the email and choose which completed forms you're submitting. Answer the questions about which forms you want to submit and attach the forms and evidence. Once complete, you're now ready to submit the forms and supporting evidence for the review. The Commission will contact providers with progress updates. So let's just recap a few main points here. We've included a number of resources relevant to this webinar, which contain many of the helpful tools and resources that we've mentioned. You can access them via the Resources tab you can see on screen. We'll also include them when we send the recording of this session to everyone who registered.
Thanks so much, Sarah. And we'll now go to questions and feedback. So we've got lots of questions that have come through. So I might kick off without further ado. The first question for Sarah is, how do we assess if we need to be registered?
So I suspect for most people who are joining us today on this call, you're probably already existing providers and will have had engagement from the department and will be deemed to be registered providers under the new Act. So if you aren't an existing provider and you are attending today because you're interested in entering the market, then that will mean that you'll need to apply for registration. Equally, you might be an associated provider who's currently operating within the sector but don't have an approval of your own at the moment, in which case you would also need to consider becoming a registered provider. If indeed that is what you want to do once the new Act commences, you can continue to be an associated provider without registration though.
Thank you, Sarah. I'll ask, there's a question about associate providers. There's a couple actually. So the question is, we have seen some difference between how some organisations are managing associated providers. Can you tell us what is expected as a minimum ahead of 1st November for registered providers who have associated providers? So what kind of evidence, I guess, do they need to have around their associated providers?
So probably, I guess the main point is really around if you're going to be a registered provider and you are essentially subcontracting some of your services through an associated provider, is what are the steps and processes that you have gone through to assure yourself that that associated provider understands the obligations and conditions which will apply to them as they're delivering those services. So that process that you yourself have gone through to assure yourself that they will understand those responsibilities, that they'll be able to deliver on them, that they'll be delivering quality and safe care on your behalf, that is the kind of evidence that the Commission would expect to see if we come to talk to you about those arrangements. And that's the kind of information that you would provide to us at point of registration and also at point of renewal when we ask you about how you assure yourself in relation to those arrangements.
There's a particular follow-up question which might be worth asking here, which is, would we accept things like a stat dec or an attestation from an associate provider that they're adhering to requirements sufficient, or would we expect the primary provider to actually be holding the evidence of compliance?
I think it probably again depends on the kind of care or services that they're delivering on your behalf. So again, I don't want to necessarily be specific and say it needs to be a stat dec or something like that, because I think in some circumstances, as a registered provider, you would probably think that's not sufficient. You would probably want greater assurance. You know, for example, if they're delivering clinical care on your behalf, what sort of systems and processes do you have in place to understand that they're doing that appropriately? So I think it's going to depend on the kind of service that they're delivering on your behalf and the sort of circumstances of the arrangement. Because some associated providers, it may be quite a short arrangement that you have with them, it may be quite a low risk care or service they're delivering, or it might be quite an enduring arrangement and it might be a much higher risk care or service like clinical care.
Thanks, Sarah. So for organisations with large number of homes and home care, will they have to pay provider level, and then for every residential care home audit and for the home care audit all at the same time with only two? This question says with only 2 weeks notice. I don't know about the notice, but quite a lot of people I think are used to having their audits sort of spread over a period. And so could you just talk to that?
Yeah, and this is because this is sort of new territory for the Commission as well, because from the 1st of November, our focus in it is on the provider level of the entity. So at the moment, the way we're describing that charge for the audit component is as a provider with the constituent parts. And at the time we issue the invoice, then the standard payment terms are 2 weeks. If, however, what we're finding is for very large providers that's problematic, then that's absolutely something that we can look at. The main requirement is that before we undertake any of the audit activity, that we have received the fee. So if it is that we need to work with a provider and perhaps to stagger that out over a period of time, we can look at doing that. And so we'd need to have some communication with you. So again, as I said, it's sort of we're stepping into this newly as well, and if we can see over time that it's a challenge for providers, then it's definitely something that we would work with them on.
Thanks, Sarah. And this one, I don't know, might be one for Janine. What is an audit for a new provider application for categories 4 and 5 involve? Being a new provider, there are no established operations yet at the moment of submitting application. Janine, do you want to have a...
Thank you. I can go through that. So today I talked about the renewal audit, which talks about initiation, and then audit delivery, which is provider level and care delivery, and then the audit report. So what piece will be missing from the registration audit is really that care delivery level. So what we'll be looking at is ensuring that the provider has established systems and processes that give us confidence that when they actually do start to commence care delivery, that they will have a good handle on good outcomes for older people. So there may be an instance where we do actually go out and observe a site, but most of it will be without a site, most will be desk-based, and we'll just be looking at systems and processes.
Thanks so much, Janine. A question, they missed the time to apply to become a registered provider. They submitted the form on the 4th of October, so they probably won't get approval under the old Act. The question is the new application form much different than the old one?
I presume that question's for me. So I'll start talking.
Yeah.
Look, it will just depend on if we've already received your application. We've sort of trying to look at as many of them as we can. So it's possible what we'll do is come back to you and let you know that your application will get transitioned to being looked at under the new Act. And we'll talk with you directly. Someone will contact you, most likely by telephone, to let you know whether the application will actually transition over or whether or not you'll have to submit it again on the new form. The new form is a little bit different, but there are some similarities around some of the sort of tests at the point of either currently it's approval, in the future it'll be registration. So I think what you'll find is a lot of the information that you've already prepared will be able to be used. I can't remember, Liz, if you happen to mention if the provider wants to operate in registration categories 4, 5 and or 6.
No, I don't think they mentioned that.
I don't know that, but if you do, then what I would say absolutely either way, whether it's transitioned or whether you apply again, what it will mean is that you would need to have a registration audit for that part of your service delivery as well. So that bit is definitely a little bit different to the current arrangements as well. We are very close to releasing very detailed guidance that goes question by question through the new forms. That will also really help you populate that information in as well. So I would definitely look out for those. But if we are transitioning you across, we're going to do a sort of a wee webinar for those providers or applicants, that are captured in that, and we'll engage with you directly through that as well. So either way, you'll have a lot of contact from us.
Thank you. I'll just note that there is feedback in some of these questions around concern about the charging, that the charging is significantly higher than previous fees and that the waiver categories are insufficient or should be expanded. So thank you for providing that feedback. As I said earlier, this is the stage 1 of cost recovery. We will be obviously undertaking further consultations and examining the impact. But thank you for your feedback, and we will definitely note that feedback. So I'll just see what else we've been asked. Here's one. Do we need to record in GPMS all associated providers or only those who deliver services under category 4, 5 and 6?
Do you want me to take that one?
Yeah, that'd be great. Thank you.
I can't off the top of my head remember the name that associated providers have at the moment, but I am hoping people who are attending do. And Janine may also remind me if I forget. I think there's a cutoff, and I feel like it's midway through October, I think. And if I speak very slowly, somebody might remind me in time, where providers can update the particular tile in GPMS with that information. Just checking, here we go, the 17th of October. I thought it was, but I wasn't confident enough to say that. So at the moment, if you have those arrangements and you would normally update GPMS with them, you've got until the 17th, go in and update them, because those arrangements will then be carried forward into your deemed arrangements and included in the new provider register. And it would mean that you then didn't have to update the commission via a change in circumstances if you had changes, if you wanted to add those arrangements for CATs 4, 5 and 6. I think by the nature of your question, though, you do understand a differentiation, which is that in the course of your registration, if you've got changes to your associated providers related to categories 4, 5 or 6, you update us via that change in circumstances form. If there are changes to your associated providers connected to categories 1, 2 and 3, then you will talk to us about those at a point of renewal. Thanks.
One that for Janine, I think. When will the Commission be commencing its audits under the new Act? Will we be starting this side of Christmas?
So what has been confirmed from the department is that there will be no registration expiry date in the first 6 months from 1 November, but that doesn't necessarily mean that we're not going to commence audits. So my understanding is from 1 November, for those first providers that are first cabs off the rank, they will be getting their invitation to renew. So what that does mean is that we will have a small number of provider level audits that will occur this side of Christmas, but it is a very small number. But at this stage, the care delivery audits are not due to commence till January.
Thanks so much, Janine. Back to Sarah. How do you determine a provider is in the lowest 10% of the sector? Is it dollars or is it beds and consumer numbers?
So what I can assure you of is that when we write to providers inviting them to renew, the Commission will use data that we hold to let them know if they fall within that category and that they're eligible for a waiver. So it's definitely not something that a provider will have to make a case for. We will let them know that based on data that we hold, and it is based on consumer numbers. It's also a dynamic measure because obviously the size of the sector changes. So we will do a data run. I think it's around once a month, and we will use that data to inform the next bundle of invitations to renew that we provide. And we will let a provider know at that point in time that they're going to be eligible for the waiver. So it's definitely not something that a provider needs to worry about holding data on.
Great, thank you. I think I know the answer, but I'm going to go to Sarah for this one as well. Are private home care providers who do not receive Commonwealth aged care subsidies required to register?
I think essentially if you want to operate and receive subsidy from the Australian government for your aged care services in a residential setting, you would need to be a registered provider.
But if you don't wish to, then you don't have to. No.
That is correct.
Great. The question, if we have 20 community programs, TCP and 5 residential homes, would it be a sample of community programs, TCP and the 5 homes audited together every 3 years?
Yep, I can answer that one. So we'll have, as I went through the renewal audit process, we've got the one provider level audit, which covers provider level systems and processes for all of your service offering. And then all the CAT 4-5 homes will be a part of one audit. So we'll select a sample and include that as part of our audits. And then any other category 6 homes will be audited separately. So then you have one report for each of the category 6 services. You get one with the sample category 4, 5 services, and then you have a final audit report at the end. So we really use your registration expiry date as the anchor point to work backwards from that to make sure that you have an audit within that 3-year period.
Thanks, Janine. Sarah, someone's asked, why does the application for registration form on the website have a draft watermark?
So that's because it is a draft version that we wanted to release so that people could have a look at it and start to familiarise themselves with it. Because we do now have the aged care rules signed into law, we're in the process of making any final little tweaks to the form, and the final ones will be available from the 1st of November. So have a look at the forms that are there now so that you can have a look at them and sort of see the structure and the questions and so on. There will be very minimal changes to the final ones, but we wanted to put them out there so people could have a look at them, but we knew with that until the ledger was finalised, there might be some final tweaks that we needed to make.
All right. Next question. When can we vary our registration categories? We need to remove a category that we were incorrectly enrolled in.
So I would suggest that you do try, I don't know if you're too late, to engage with the department now, because possibly through the deeming process you may be able to get that corrected, but I don't want to guarantee that because I'm not the department, but it is the system governor who will make the decisions around deeming. If post 1 November you still find yourself in that category that you don't want to be in, you can make an application from that day forward.
Thank you. Next question. Are you able to use a consultant to assist with the application, or is this frowned upon?
It's not frowned upon. I think the main thing that we say is that we need to know that applicants have, or indeed if you're existing providers for renewal, we need to know that as an entity, you understand the obligations and conditions that apply to you, and you understand how you're going to structure and deliver your business to meet them. And so I think the point in which we become concerned is if we see applications that come to us where a consultant has clearly been engaged, which that in and of itself isn't necessarily problematic, but we do see applications where we have things like governance structures which don't actually apply to the organisation that's applying. We might see policies or procedures that clearly apply to a different entity, or are just completely off the shelf ones that haven't yet been modified. So I think it's those kind of elements that starts to lead us to be concerned around whether the applicant actually understands the nature of the business that they're going to operate. So it's absolutely not frowned upon, and indeed there are many very fine consultants operating that provide a very supportive service to help applicants come into the market, but I would say you must absolutely use them as a support service. They cannot replace your own sort of capability to operate within the market.
Thanks, Sarah. One for Janine. How regular will audits be for existing providers?
So the registration period is up to 3 years. So as I said before, we use your registration expiry date as an anchor for when we will undertake the audit. So it is totally dependent on that registration expiry date.
Thank you. And I might ask you this one as well, Janine. I'm still unclear how care delivery audits will occur for a large provider that's multi-site, 100 plus sites in category 6.
Sure. So the legislation allows us to actually start the audit process up to 18 months before. So for these larger providers, we'll absolutely be utilising this time. So it might mean that 18 months before your registration expiry date, we start that audit initiation process with you. It may also mean that for those sites that we may have to undertake audits at sites at the same time. But what we need to remember here is the audit methodology is changing. So in current state, what it would look like is when you've got a provider that's got lots of sites, when we undertake an audit, everyone from the head office comes down to that site, and it's all everyone stops what they're doing and really, you know, engages in this audit process. But because we've got this provider level audit, we've already collected that provider level evidence. So really, when we get to the care delivery location, all we're really looking for is to speak to the site management and staff that are on site and talk to the older people. So it's actually a lot more seamless in that regard. And so we do have the ability to audit multiple sites at the same time if we need to.
So if you're a provider with more than 100 sites, it might be that we're doing all of them within a 12 to 18 month period.
Correct.
And then presuming they're all achieved 3 years, then
Correct.
we wouldn't do them again until they came up again.
Correct.
Thank you. This is a good question for Sarah. Do we need to submit a budget in the application? There isn't one on the draft application.
I think it probably depends. One of the things we look at in both registration and renewal is sort of your financial arrangements that you have in place. So one of the things we'd be looking at, particularly when you're first coming into the market, is your sort of forward plan. So how you think the sort of income that you think you're going to generate, how you're going to structure your financial arrangements going forward. And so one of the things that might be useful for you to provide to evidence that kind of thought process that you've gone through is a budget that actually shows you've stepped through the kind of financial arrangements that you're going to have in place. So again, I'd say it's one of a number of possible different types of evidence that you could submit for that. And in the guidance that we'll release, it's got some examples of the kind of evidence that we would be looking at.
Thank you. Got time for a few more. Back to Janine. Will the Commission still undertake unannounced visits, and will there be a cost to the provider for this?
Yes, we will be undertaking unannounced visits, but not for the purposes of audits for registration. So we have our risk-based monitoring or inspectorate, which undertake audits as intelligence comes through indicating that we need to get out there and engage with providers around it. So no, from my understanding, there's no cost associated with that. I don't know, Sarah, you might want to jump in there, but certainly in terms of audits for the purposes of registration, they are all announced. So yeah.
I can confirm that, Janine, there's not any cost associated with any of the risk-based monitoring activity.
Thank you. With the delay in implementing the new Act, will registration expiry dates that were granted prior to moving the date for the start of the new Act also be extended?
In simple terms, yes. My understanding is that from very early in November, potentially the 3rd of November, which I think is the first working day, if you go into GPMS, you should be able to see your new registration renewal date if you're a deemed provider. And I understand that the department is also going to be writing to providers again around the same sort of time period to confirm. I think for many providers, that will mean that the earlier date they were given is going to be shifted out a little bit. The department has had advice from the Commission, because obviously there's a big arrangement of scheduling of audit activities and so on sitting behind that. And there are a few providers who may not necessarily have shifted back exactly 4 months, but the bulk of them will. And as Janine had said, what we're absolutely clear about is that there will be no renewal dates within 6 months of the commencement of the new Act.
And people will hear from us, won't they? They don't have to.
No, in all occasions, the renewal process will start with us engaging with them and inviting them to renew.
Yeah. Another question about third-party arrangements or associate providers. The questioner says, I have a physiotherapist and a podiatrist who visit our residents periodically. We pay them for their services to our residents and have contracts with them. Are they deemed a third-party arrangement that needs to be notified to the department through GPMS?
So I think probably the best answer I've got for that, because I know there are lots of different scenarios around this, is that the Commission is very close to finalising a regulatory bulletin around associated providers, because we have had a lot of questions, and it's actually got a number of scenarios in there and describes what is or isn't an associated provider arrangement. So I would say keep a look at the Commission's communications and our website, because we should be releasing that very soon. So I would say have regard to that, and it should help you step through and be clearer on whether or not those arrangements would meet the definition.
Thank you. All right. Thank you so much, Sarah. And thank you, Janine, for answering the questions. Thank you all for sending through lots of really interesting and thoughtful questions. We haven't got through all of them, of course, but we will obviously be using those to help us inform our guidance material and what we provide as we get closer to the new Act commencing. So I want to again thank you all for joining us today. Just a reminder, today's webinar will be published on our website in the next couple of days, and you'll be sent a link to the recording as soon as it's available. And finally, just a reminder, there'll be a feedback survey on your screen immediately after this, and that a recording of this session will be published online shortly. So until next time, thanks so much for joining us today.